No máa record it. That's I would defer now. Doing a class.
Hello, good evening, everybody.
Good evening.
Yeah, happy Sunday.
I wish you same. Thank you so much.
Thank you. All right, so we're going to begin the classes right away because it's 8 p.m. So please, can we kindly mute our microphones?
Like it's good. Everywhere they dark.
Please, can you mute your microphone, please?
I'm you take.
All right, let me share my screen. Um, I believe we can all see my screen. Please, can one person just unmute and tell me, can you see my screen? Or you can send, okay, let me see. Or you can send it. Okay, perfect. All right, so welcome once again to the class. This evening, we're going to continue the class that we were, the thing we were talking about the last time that we met. So let me confirm that I am recording. I think so. Okay, we're recording. All right. So today we're going to go into details talking about epidemiological study design. We had already started the conversation earlier on. That was the last session we had. So in this session, we're going to, the last one, we sort of like try to introduce research and all of that. So now we're going to go into the core of it and talk about various types of study designs. The goal is that by the time we finish this class, because this is survey and research methods, and it's like a branch of epidemiology. So if you have noticed epidemiology, MPH 8103, I think that's principles of epidemiology. If you have noticed, you will see that there were places in the class or on our LMS where they also talked about study designs, right? So it ties in. This one we are doing, it's still like a branch of epidemiology, basically, because it's epidemiological study designs that we are learning. All right. So we've talked about the importance of study design. We've said why it matters, that it's like a guide, a framework. Remember that we said one of the things, the important things that we're trying to do is we're trying to provide evidence. And, evidence is going to inform action. It is based on our results, based on the evidence we are able to produce that we can that's what we base our action on. We don't do like, vibes and inshallah, or I think this is what is going to work. No, we have to like to a good extent know what works and what doesn't. And study design, I said it's the analogy I gave was like when you have a stair and then, when you build a stair, there's most likely going to be something like a guardrail so that when somebody is climbing that stair, like whether up or down, the person doesn't fall away. So that's like what a study design is. It guides us. It guides us throughout the research process. It guides how we collect our data, the way we select participants, and the way we interpret the data. It guides all of this. So it is very, very important. Today we are going to focus on the classification of epidemiological designs. So there are like quite a number of them, and sometimes it gets a little bit confusing. So we're going to do our best to see how that by the end of this class, you can be very, you would know it's not a thing of cramming, like you would understand what is happening, such that even if there's any study that maybe is not mentioned here, if you hear it, you know where to fit it, you know where to place it under, okay, this is what is happening. So that's what we intend to achieve today. The class may go a little bit beyond 9 p.m., but I'll try to see how we can end by 9. But I want us to finish this topic, this study designs. I want us to finish it this evening. So epidemiological study designs, the classifications, there are like two broad classifications, two big umbrella or two broad classifications. Like there are two major classifications. There's the observational and there's the experimental or interventional. So just like the names imply, observational means I just dey observe. The researcher is just watching. The researcher is there to observe, to see, okay, what's the disease pattern? What's happening in this community? How many people here are vaccinated? How many people here have this particular disease? That's what's happening in observational, right? And then in experimental or interventional studies, what's happening there is that there's manipulation of a particular exposure of a particular factor, right? So it's the way they say it is manipulation of an independent variable. So for those who like, just so that we are all on the same page, when I say independent and dependent variable, let me explain dependence first, then we can understand what independence is. So for a dependent variable is something we can also call like the outcome variable. So we want to know, for instance, we want to know how many people who smoked came down with lung cancer. So lung cancer is the outcome variable. That is the dependent variable. Why is it called dependent variable? Because it depends on smoking. We're trying to say that this lung cancer is an outcome that depends on whether a person smokes or not. So that's why that one is called the dependence variable, that outcome variable. It depends on the independent variable or the exposure, right? So in experimental research or interventional research, we're manipulating something, and what we are manipulating is an independent variable. So we're trying to change things to see what the outcome is going to be. What effect is it going to have on the outcome? If I add this, if I give this, what is going to be the result of it? That's what is happening in experimental or interventional research. So now let's talk about observational study design. Let's talk about observational study design, right? That's one of the big umbrellas in epidemiological study design. So this image, this picture here, it's just going to be like a guide. So we can just have it at the back of our mind. You can see the flow. You can see the flow. It's going from, it's first of all shows up, there's observational, down, there's interventional. Then observational is further divided into two, and then interventional goes straight to all these other ones. Now, there are some other study designs that are not here. Everything is not listed here, but these are like the main ones. These are like the core, or these are like the ones that we're going to come across more often, right? But we'll still try to mention all the other ones so that we can just have an idea of what's happening. So in observational study design, we already established that the researcher is not manipulating anything. Your own is to just go there and observe and count and see what is happening. Now, the thing we should put at the back of our mind is that observations are not at the same levels. There are different levels of observation, right? For us to understand it, that's why I'm saying it like this, that there are different levels of observation. Let me just use a random example. If a person comes and says, hey, there CO on all of these mountains, there fire is burning, I can see fire on these mountains, that's one level of observation. Now if another person comes and says, these mountains, this is their circumference, and this mountain, they have dry grasses on them, so I can see that the mountains that have dry grasses, they are the ones that are burning, but the ones that don't have dry grasses on them, they are not burning. Now those observations, they are different levels. The person who just says there is fire on those mountains or fire is burning, oh, that's one level of observation. But the person who then goes to say, I can see that there are dry grasses on the mountains where there are fire, but the ones where there's no fire, then there are no dry grasses, there's no fire on those ones. So we can already see that it's observational, but there are different levels. So that's where we talk about descriptive and analytical observational studies. So remember where we are coming from. We said there are two big umbrellas, observational and interventional. So now we are talking about the observational studies. And we said that observation, they are not at the same level. There are different levels of observation. And that was where we said there's descriptive and there's analytical. It does not mean, when I say they are different levels, it does not mean that one is more important than the other. No. There's no study that is, in quotes, more important. It depends on your research question. It depends on the question that we want to answer. That's what will tell us what the best kind of study we should use. So it depends. So when I say different levels, it's just for us to be able to understand it. Now, let's talk about descriptive study design. Let me take this down. So in descriptive study design, it's just a study design that what it does basically is to describe, as the name implies. And remember in the previous class, I think I mentioned it, that when we talk about description, is in terms of place, is in terms of place, is in terms of person, and it is in terms of time. When we are talking about description in epidemiology, we're talking, distribution in epidemiology, we're talking about person, we're talking about place, we're talking about time. So who are the people being affected? You have decided that there's something you want to study. There's a question you want to answer. The example we have here is, we want to know percentage of adolescent girls who have received HPV vaccine in a city, broken down by age and school time. So we can already even see the elements. In descriptive studies, we are describing the distribution most times. So who is affected? In our example now, we say adolescent girls. They are the ones who are being affected. Where are these girls? Now we can see, okay, that it seems we're interested in girls that are in school. But in the study, we have to go further to, talk about the geographical location of these girls and then describe that location. Is it an urban? Is it rural? And all of that. So we're going to describe both in person, in terms of place, and in terms of time. When is this thing happening? For instance, we want to study malaria. It's seasonal. When is it happening? When does this thing happen? So descriptive studies basically want to describe distribution. That's all you want to do. You just want to go there and see who has it, where, when does it happen. That's basically what we aim to do with descriptive studies. So here, there's no such thing as comparison. We're going to explain what all of this, I don't know if we explained it in the previous class. Well, there's no such thing as comparison. There's no such thing as testing relationship. Don't worry, we're going to talk about these ones in detail. So descriptive basically describes. Now, for descriptive studies, I'm going to go on to now talk about the different types of descriptive studies before we now go back to talk about the analytical studies or study. So for descriptive study, what is happening in descriptive study? We've already said it. We are describing the disease, we're describing the distribution and determinant. That's what we're doing. No, distribution. Then one of the things that we do in descriptive study is to it helps us to generate hypothesis. It helps us to generate hypothesis. Now, how does it do that? For instance, by the time we have gone to a particular community A, and see that a particular outcome is more in that community, a particular health event is more in that community, and then we go to community B, and we're seeing that it's not as much as it is in the other community. Now, there's a question that comes up in our mind, and that question is why? Why is it like that? What is happening? Now that becomes a hypothesis. That's how hypothesis is formed, basically. Like, that's the simple way to explain it. So in descriptive observational studies, we describe in terms of distribution, and then after doing after describing, we're going to find patterns. We're going to notice some kind of patterns from the data. And then it is those things that we notice that now they start raising question. That's why we say we can use descriptive observational studies to generate hypotheses. Now, what are the types of descriptive study design? Descriptive observational study design, what are the types? There are different types of descriptive observational study design. So the first one here is called case reports. The first one here is case reports. In case report is not a very typical epidemiological study design, and we're going to find out why. But in case reports, what is happening mostly is, it happens oftentimes it's in the hospital setting. So for instance, a doctor notices just something that is rare, something that we don't really see that much. Now you can go ahead to now write about it, describe it, and talk about it. That's case reports. You're basically describing a rare event, and oftentimes it's in a single patient. So the example that we have here, it says a rare adverse reaction to a new vaccine in one patient. So there's an immunization program that goes on. Children receive vaccines, and then a child, after receiving the vaccine, for instance, we notice that the head of this child just starts swelling out of proportion. It starts swelling. And prior to that time, the child was okay. And there was nothing else that had happened apart from the child receiving that vaccination. Now, that is a rare event, and it has to be documented. We cannot, it has to be documented. We cannot just ignore it. So that's case reports. For case reports, we're dealing with one patient, one person. And usually it is in cases of maybe like rare diseases or unusual outcomes, something that we are not expecting, and then we see it. We have to do a case report on that thing. So it is not a typical epidemiological study design, because when we were defining epidemiology, we were very much we're talking about population, that we're not very interested in the individual, that is population we work with. But the reason we include it is because if, for instance, that one child has that reaction, that adverse reaction to the vaccine, and we just let it slide, we are not bothered, we let it go like that. What if there are other children that will start developing that way? And before you know it, it's everywhere. And then it becomes a population-based problem or disease. So you see why, even though case reports it focuses on one patient, we still term it an epidemiological study design. Remember, it is a descriptive study design. So basically, what the doctor, the physician, or whoever it was, the healthcare professional that noticed that thing, what the person is going to do is to write a report and alert the health bodies and say, this is what we found. So that is case report, and I hope that one is clear. Now, the next one under descriptive study design that we are going to talk about is still similar to case reports. So if you see the image I added here is the image of like just one person. That's just one case. So that's case reports. Now, the next one is still similar to case reports, but this one is now called case series. And if you can see my screen, you would see that there are now, instead of just one case, we're now seeing like 4. So if like the doctor noticed that event of the child's head, swelling, and the child's head is becoming enlarged, and let me say the doctor noticed it on Monday, and then on Thursday we notice it in another child, and then Friday we notice in another child, and then the upper week we notice. Now we have to write about all of these cases that we have seen. So it's no longer going to be case reports that we call it. It will now be called a case series. And basically what happens there is to explain, see wetin my eyes see. This is what I observed. That's what's happening there. So if we're following it, we see that case report and case series, they are similar. And they are not the very typical epidemiological study design, but they are epidemiological study design because I've explained why. They are mostly used for cases that are rare, something that we don't see often. So when we see it, we have to talk about it. So those are, we've mentioned two categories or 2 classes of descriptive observational studies. So now we're going to go to the third one, which is cross-sectional descriptive studies. Now, bear in mind that I'm saying cross-sectional descriptive because when we come to analytical studies, we're still going to mention cross-sectional. It can be both an observational study and an analytical study. So it can go both ways. There's a type that is cross-sectional descriptive. There's a type that is cross-sectional analytic, so that when we see that one, we won't be confused. Now, what's happening in cross-sectional descriptive study? In cross-sectional descriptive study, we are measuring exposure or outcome. And the point of this cross-sectional descriptive study is that we are doing it at one point in time. Another word they used to describe this cross-sectional study is snapshot. Like a picture, bam. So what's happening there is that we have a particular outcome in mind. We have a particular thing we want to study. For instance, we're talking about one of the examples we mentioned then was human papilloma virus vaccination. That's HPV vaccination. So cross-sectional descriptive study is where you go into the field or wherever your study area is, and then you collect data to just know, okay, who are the people that have this thing, and that's what you're interested in. Who are the people who have this thing, and who are the people who don't have it? That's what you're interested in. It's done, the data, they are collected at the same time. And by the same time, I don't mean it has to be the same day. No. Sometimes data collection can take up to a month. It can even take more. But the point is that the person you counted before, you're not counting that person again. Everything is done at a snapshot. Like, we just want to know what the picture on ground is. We want to know what is obtainable at this place. In this particular population, we want to know how many people have polio. And so we are going to go around trying to collect data and all of that. The data collection can take us weeks. But the point is that we are doing it at one time. So that one time does not mean one day. It's done at a particular time, but not one day. The time can mean we are doing it across weeks. But the point is that the people we've counted before, we are likely not going to count them again. We just want to know what is on ground, basically. That's what cross-sectional research and descriptive research is. So if you see the image we have here, we have a clock. And then it's just depicting that it's a snapshot. That's a very key word for cross-sectional research, is a snapshot. Now, the reason I'm emphasizing it is that when we go to some studies, there are studies where you will follow the participants. You will not collect data just once. No, if you collect data this year, you will collect next year, you will collect next 2 years, you collect next 3 years. There are studies like that. So it's a key differentiator. All right. Other types of what's it called, descriptive observational studies. We have ecological studies, we have surveillance studies, but I don't want to like dwell much on those ones because of time. And also, let's focus on the ones that are like the key ones. For these other ones, we can just check it up ourselves. Okay. But what is happening? Let me just give a small overview. What is happening in ecological studies is that we are looking at groups. So instead of saying how many people have this, is groups we are looking at. It's like we're looking at clusters. That's what we are looking at. I'm just using that word cluster loosely. That's the units of our analysis. Example here is when we are comparing cervical cancer rates across different countries. That's an example. So we say which country has a higher rate of cervical cancer. So we are looking at the countries as if they are entities, individual entities. That's what's happening in ecological studies. When we analyze as if that group is an individual entity, as if it's a unit on its own. If it is schools, we are looking at each school, we are looking at it as a unit. So in this school versus this school, how many? That's how it's going to be. We're comparing across groups, across clusters, across populations. Then surveillance studies is like what we are monitoring is trend over time. That's surveillance. We are monitoring, continuous monitoring of pattern, of disease pattern over time. Then we are going to move ahead to talk about analytical observational studies. So a brief recap, I will go back to the image we have up here, just for us to see it and look at it again. So observational studies, we have descriptive and analytical studies. And we have talked about descriptive studies. We've talked about case reports, we've talked about case series, we've talked about cross-sectional studies. Now we want to go to analytical studies. If you remember, when we were talking about descriptive study design, I mentioned something that it is used for generating hypotheses. That after you've collected the data, for instance, from the different countries, and you see that the average year or lifespan of somebody in Nigeria is 54 years, and then for another country is 68. You see, so why are people not living that long in this country, in this other country? Or a community, you see that there's a very high prevalence of maybe cholera, maybe malaria, compared to the other communities. And then we begin to ask ourselves, why is this thing happening? And if you remember we said observation, they are not of the same levels. So it's an analytical observational study. That's where we now get our head into why is this thing happening. So in descriptive, we generate hypotheses. So we have looked at patterns and we have observed. And that observation will oftentimes leave a question in our mind. It is in analytical observational studies that we now say, let us even know why this thing is happening. So for descriptive, we are generating hypotheses. For analytical, we are testing hypotheses. We're testing hypotheses. We're trying to also establish associations and to quantify. So the example we have here is between level of education and health-seeking behavior. So health-seeking behavior is the outcome. And we're trying to see the exposure now. The exposure variable is the level of education. Or we can call it the independent variable. While the outcome variable, the one that depends on something that we are saying it depends on this or that thing, that one is the health-seeking behavior. That's the outcome variable or the dependence variable. So now we are trying to establish an association. Probably when you were taking data, after taking the data, or maybe data that another person has collected, and you are reading the paper and you are seeing that in these communities, they have good health-seeking behavior. Meanwhile, in community B, they don't have good health-seeking behavior. And then you see another data where you also find that in community A, the level of education is high, but in community B, the level of education is not as high. Now you can begin to, make some postulations, which is the hypothesis we're talking about, to say it seems there's an association. It seems there's a link, there's a connection between the level of education and health-seeking behavior. So it is using analytical observational studies that we will now find out whether true there's an association. So remember we said for descriptive, we generate hypotheses. For analytical, that is where we test the hypothesis. This thing we think, this idea we have in our head, and maybe there's a connection. It is in analytical that we now test it to see if there is actually a connection. And if there is, we also want to quantify to say how strong is it? How strong is this association? Is it so strong that maybe wherever you see low level of education, you must see poor health-seeking behavior? If we're saying that unsanitary environment causes cholera, how strong is that? Or no, not causes now, predisposes. How strong is that association? You see, okay, wherever you see unsanitary environment, you may see that the people there are likely going to have cholera. So it is in analytical studies that we are looking at association, and we want to test our hypothesis. So that's why I said two of them are observational studies, so both descriptive and analytical, but they are not of the same intensity, or they are not the same level. Okay, so now let's talk about the types of analytical observational study design. So this is a diagram that I have here. In analytical cross-sectional design, we are measuring both exposure and outcome at the same time. At the same time, everybody together, we are taking them. So an example we gave here is there an association between obesity and hypertension? So we come to the population like this, our studies, our sample. When we come there like this, the study area, we just start collecting the data from all the people that meet the criteria. We start collecting our data. Whether you have obesity, whether you have hypertension, whether you don't have anyone, we are collecting data from everybody. Now, when we finish collecting this data, we will now go and start checking. We'll first of all split them into two. So those who said yes to what's it called? Those who said yes to obesity. Now let me explain. In this study that we are talking about, obesity is the exposure. So that if you are seeing exposed and non-exposed, you will understand what is happening. Obesity is the exposure. Hypertension is what is being referred to as cases. Whenever we see case, it's talking about the outcome, the presence of the outcome, people who have it. So we have obesity and then we have hypertension. So obesity here is the exposure, and then hypertension is the case. That's what we use to decide case versus non-cases. Okay, so we've gone to the field now. We've taken our data. Now, when we come back, the way the analysis goes is that it will now split those who had the exposure, that's those who have obesity, versus those who are not obese. So those who have the exposure versus those who are not exposed to that thing. We'll split them into two. Now, we'll now go further to now look and say, among people who have the exposure, among people who have obesity, how many of them have hypertension? Who is drawing on my screen? Among people who have obesity, we will now look at how many of them have hypertension, how many of them do not have hypertension. Remember, we're trying to find if there's an association. Then we come to the population of those who do not have obesity and say, okay, among this population of those that don't have the exposure, those who are not obese, how many of them have hypertension? How many of them do not have hypertension? So let me show us a table below. If you see this table, we see obese on this side versus non-obese down. And then we see the outcome, hypertensive versus not hypertensive. So the exposure on this side and then the outcome on this other side. Now look at what is happening. Among people who are obese, the total number of people who are obese here, we have 20. So we've collected our data. The total number of people who are obese, 20. Out of these 20 people that are obese, we see that 8 out of these 20, 8 have hypertension. 12 are not hypertensive. Out of the non-obese, 4 are hypertensive, 14 are not hypertensive. That's for the 18 that are non-obese. Now, this is how we would there are a lot of statistical, like there's a statistical method and ways that we are going to do the analysis that will now tell us if, okay, a person who is obese is more likely to have hypertension compared to a person who is not obese. Or it can tell us a person who is not obese is the one who is more likely to have hypertension compared to a person who is obese. So that's what's happening in cross-sectional analytical study. Remember, the other one we talked about was what was descriptive. There, what you will just do is to find out how many people are there in this population. You will say the total number, there are maybe 20. You say, okay, how many have the disease? How many don't have it? That's all we're interested in. That's all we're interested in. But when we now talk about the cross-sectional analytical, we are not just interested in how many have, how many don't have. We're not just interested in that. We also want to know what are the risk factors? Why are these people developing this thing? What can we associate with it? So that's what's happening here. And once again, for cross-sectional, remember that the data is collected at a snapshot. And I said that snapshot does not mean that it has to be one day. No, the data can be collected over weeks. Why it is different, why it is called snapshot is that there are studies where you will follow your participants, you will follow your respondents over a long period of time. So you are not collecting data just once in those studies. So you will collect again, you will collect again, you will collect, you keep measuring. But for cross-sectional, we collect our data and we move. Okay? And remember I said we are measuring both exposure, the people who have the disease, and outcome at the same time. We are counting everybody. And then when we go back home, we can now try to see the figures and see, is there a link between this one and this one? Okay, let's move ahead. So the next thing here is case control. Case control study. Now, we just finished talking about a cross-sectional analytical study. And I said we are measuring both the outcome. Outcome is also cases. When you hear cases, when you hear outcome, when you hear that diseased is the same thing. So we're in case control studies. What is happening here? Look at the name, case. Remember I said case means there is presence of the outcome we are looking for. So if it is a disease, the disease is there. It's there already, case. And then control. Control means it is not there, non-diseased. This is not yet a case. This does not have the outcome. So case control study, both the case and the control. Case control study. Now look at what is happening here. In cross-sectional, we're measuring both exposure, that is case and control at the same time, exposure and outcome at the same time. In case control, what is happening is this. We will find we're starting from the disease status, from the outcome, and then we walk back to try to trace the exposure. Stay with me. Now, we are looking at, let me use that example we had before, obesity and hypertension. We will start with the outcome. What is the outcome? The hypertension. So we are going to bring people who have hypertension and those who do not have hypertension. If you listen to this thing I said now, I did not mention exposure. I did not talk about exposure. We are not concerned about it yet. Our starting point, the beginning of case control study, is outcome. Is outcome. Case, outcome. So we're starting from the diseased state. Who has the disease? Who have the disease versus who doesn't? That's where we are starting from. So if we're going to go into the field, we're going to be looking for which person has hypertension, which person doesn't have hypertension. That's what we're interested in, the outcome. Now we will now start from this outcome and try to trace it back. Remember that what we are doing is to establish association. This method, this case control studies, you start from the outcome and then try to trace it back. Look at it. You will start from who already has cholera. You see, this person already had cholera, this person didn't have cholera. Now you will sit the two of them down and you say, okay, tell me, your house, is it clean? The area around your house, is it how sanitary it is? Then the people who have cholera will say, it's not very clean, no. Our waste, we don't used to dispose it often. Our water is not clean. You get all those kind of data, and then from the control you are seeing that they are telling you that we don't have cholera, our environment, they are clean and all of that. Now remember that sanitation is the exposure. Now we are trying to trace from outcome back to exposure to say people who have the disease versus people who don't have it. Let us see what they were exposed to that made them develop this thing. So we go back we're going back. I hope that this thing is actually being that it's clear to us. So for case control, if we are doing the study, we are not going to say if we're doing the study, the population we are working with is people who have the outcome versus those who don't have the outcome. So we're saying hypertensive versus non-hypertensive. We're saying they have malaria versus they don't have malaria. That's our starting point. That's where we're starting from, the outcome. Presence or absence of the outcome. Outcome is what we are starting from. Then we will now start taking it back to identify the associations, to say what was this person exposed to that the other one was not exposed to. So this person that had malaria, what were you exposed to? And then this one that didn't have the malaria, it means you were not exposed to that thing that this other person was not exposed to. So we start from the outcome and then we are taking it back to find out the exposure, to try to find out what were the risk factors, what happened. Okay. Now, there's a reason we do this kind of study. We do it because it is kind of cheap compared to some other studies that we are going to mention. Hopefully, we are going to talk about the limitations and use cases of all of these studies, right? Now, let's move ahead. But before we move ahead, remember that I said exposure versus outcome. And for cross-sectional analytical study, we are measuring the two of them. We are taking everybody, whether you have risk factor, we are taking you. Whether you are not yet exposed to the risk factor, we are taking you. Whether you already have developed the disease, we are taking you. Whether you have not developed the disease, we are taking you. We are taking everybody. And then when we go, we are now looking and seeing, is the disease more in people that have the exposure versus those who don't have the exposure. That's what's happening in cross-sectional. And then for the case control, I said the people we are interested in is, we're not going to say whether you have the exposure we are taking, no, rara. What we are interested in is whether you have the outcome or you don't have the outcome. So we are looking at outcome. That's our start point from case control. We start from there and then we now start to take it back and say, let's go, tell me, what were the things you were exposed to? We now start to ask questions to find out the exposure, the things that would have caused them to have this outcome. Now, the next study design under analytical study design is the cohort study. So for cohort study, cohorts If you see sometimes when they're advertising all of these programs, all of these events, maybe training or something, they will say cohort 1, cohort 2, cohort 3, something like that. So cohort basically means that all of them, they are starting together and they will progress together and likely end together. That's cohorts. So what's happening in cohorts? In cohorts now, our start point, what we are interested in is exposure. Exposure, that's where we are starting. That's where we are starting our research from, the exposure. Who have been exposed to this versus who have not been exposed to this. Those are the groups that we are interested in our cohort study. So who was exposed to malaria bites versus who, I say malaria, mosquito bites versus who was not exposed to mosquito bites. That's cohort study. We are starting from exposure. That's our start point. The other study we just talked about is the outcome. Who developed malaria versus who did not develop malaria. And then we now take it back to find out what were you exposed to that made you develop this malaria. But in cohort study, our start point is the exposure. Who was exposed to mosquito bite versus who was not exposed to mosquito bite. So after we have seen these two group of people like this, we will now be following them. We will now start to follow them to say, okay, let's know among these two group of people that mosquito have bitten, let's see who will develop malaria. Let's see, there will be incidents of malaria among these. Which one will have more incidents of malaria among this group? Such that if it is now more amongst those that were exposed, you will say, oh, that was what we were thinking, that this factor, if you are exposed to this factor, is likely going to predispose you to having XYZ. So if you are exposed to malaria bite, you are likely going to mosquito bite rather, you are likely going to develop malaria. So for cohorts, we are starting from exposure. From exposure, we move and keep following these people. It is cohort. Cohort is also known as follow-up. We are following them. We are taking data at different points, monitoring to see who is coming down with the disease, who is coming down with the outcome, who is coming down with the outcome, and you are checking, is it more in those that were exposed to this thing, or is it more in those that were not exposed to it? That's what we are doing in cohort study. Now, there are two main types of cohort study. So I'm going to show us this image. There are two main types of cohort study. It gets a little bit confusing, but we're not going to be confused in this class. So if you look at the arrows down on my screen, the two last arrows now, leave the ones up. Focus on the two last arrows. You will see that there it's written prospective cohorts for the one on top, and then retrospective cohorts. And if you see the start point, exposure to outcome. Now, if we look, I also try to delineate the time. So we have this column for past. I just used it as a way to, represent this thing in a way that may help us understand. So this column here is past. Then we have present in the middle, and then future. So let's take a look at this prospective cohort and retrospective cohort. Let's focus on it. See the prospective cohort. See what is happening. It's starting from the present and is following those people into the future. Say this person is smoking. You are exposed to smoking, to smoke. So I want to follow you into your future. I want to follow you into the future to see whether you will develop lung CA or not. So you start from now, the present. That's prospective. And you're following them into the future to see whether they will develop the outcome or not. Now look at retrospective. Look at the place where retrospective cohort is. retrospective cohorts is still similar to prospective cohorts. I can almost say they are the same thing. But what is happening here? The key thing that is different is that for the retrospective cohort, it's like if a doctor goes or a researcher goes to the hospital and packs case notes of what has happened in the past, case note of past patients, and says this patient once said he's smoking on his case note. Okay, you take that patient. This one still around the same time. Okay, not smoking, you take that one. This other patient smoking, you take that case note. This other one does not smoke, you take that case note. And then you go and sit down and you start to flip the case notes to see these patients, which of them eventually developed lung cancer. So if you observe what is happening, it is the use of historical data. You are still following up those people from exposure to outcome. Say you were exposed to this risk factor. I want to follow you to see if you developed it. But unlike prospective cohort study, where you are starting from now to follow them and say, let me follow you into your future to see if you will develop it. In cohort study, you're traveling back in time to look at records to say this person was exposed to this. Did they eventually develop this? So that's why it's called retrospective. It's still the same thing happening in prospective, where you follow those people to see if they develop the disease or not. That's what is happening in retrospective. But in retrospective, it has already happened. All of these things we're talking of, the outcome, they're already present or not. The fate of those people have already been decided. It's like, let me just say, maybe people who are already, let me just use this rough example. People who are already maybe late, people who are dead. We take their case file to start checking, and we see that, okay, they were exposed to this, they had this exposure. We now follow it and say, okay, all through their lives, let's see if they eventually developed this outcome. That's what happens in retrospective cohort study. While for prospective, we follow them from today, and then we start to go into the future to say who will develop it. We're looking for incidents. Who will develop it? So that's the difference between retrospective and prospective cohort study. Now, I'm not trying to confuse us, but I need us to know something, or at least just let me say it so that it will be on record. In case we want to listen again, it's just important for us to have it at the back of our mind. There are some group of thoughts that we say retrospective, we are following from the past into the present. But that's actually not that's not correct. But it's something to take note of in case we are reading, because I know sometimes we see different answers. This one is the one we think is correct on our LMS, or something is not correct, or something like that. Whichever one they say on the LMS, we can take it, but we just need to have at the back of our mind that actually in retrospective cohorts, both the exposure and the outcome, two of them, they've occurred. The one where exposure has happened in the past and maybe the people are still alive, or the case is still ongoing, I want to follow it. That one is an ambi-perspective cohort. Is actually a thing. It's like a combination of the two. But these are the two main ones that we've said now, prospective and retrospective. Okay? So we've talked about cross-sectional studies. If you look at this image here on top, the first arrow, you will see cross-sectional studies sitting in the middle. So it's in the present. We are concerned about the present. If you look by the side, you see exposure in blue and outcome in red. So we are looking at both at the same time in the present. Case control. Remember, whenever you hear case control, an easy way to know where it's starting from is case, wahala, case, the outcome doesn't always have to be wahala. Sometimes it's good outcome that we're looking at. Do you understand? But case control, just know that we are starting from outcome. There's already case. We're already saying case, outcome. That's where we are starting this journey from. So we start from outcome. People who already have versus those who don't have that outcome we are looking for, and then we take it down to exposure to find out what they were exposed to. Well, were they exposed to these things or not? Well, for cohort, we start from exposure to see if they will develop outcome. Now, this thing is very important because eventually we're going to be talking about measures of associations, things like odds ratio, incidence, risk, and all of that. So it's important for us to put this directionality, this direction at the back of our mind. And it's not difficult, walai. Okay, so let me see. This is already 9. Let me see what else can we cover. I was hoping that we could finish all of this today, but I also did not want to rush through it because finishing it without us having a clear understanding really won't do much for us. So let me see. Please, would we prefer to maybe I would share this material and then we study it, or should we complete the explanation? I will try to see if we can finish it in the next 30 minutes. We can unmute our mics and answer, please. Okay, I think I removed the mute, I made it in, okay. Please, let's respond via messages because I think, okay, I have a couple of continue, share the material, continue, share. Okay. So let's see, we're going to get to 9:30. So I'm going to be very fast. And then by 9:30, we are going to, okay. Thank you. So by 9:30, we are going to end the class. I'm really sorry that it's taking this long. All right. So let me see. We've actually covered observational study design. So at this moment, I think that we are pros at this moment. We've covered it, and I'm very proud of us. We've covered observational study design, the descriptive versus analytical, and then the ones under descriptive case report, series, cross-sectional. We also mentioned that there's surveillance and ecological there, and then under analytical we said cross-sectional, case control, cohorts, and then there's also ecological. Okay, so I think we've done good with that. Let me see, the next thing should be to talk about the second group. We're actually already talking about it, so I'll be very fast. We may spend 15 minutes or so, but I'll try to really be fast so that we can go and rest. I know we have work tomorrow. Okay, so like we mentioned, we said the umbrella, we said there's observational and there's what's it called? Observational and interventional or experimental study. Okay? So we're going to talk about experimental study design now, very quickly. So experimental study design. Remember we said, okay, there are some people that refer to it as interventional, and there are some who say there's a difference between interventional and experimental, but that one is not really our cup of tea. Just know that if you see experimental, it's loosely translating to interventional study, right? Okay. Now, when we now talk about experimental studies, there's a distinction that we need to make. There's something referred to as a true experiment versus a quasi-experiment. A quasi-experiment is, it looks like it's similar to an experiment, but it is not. If we go by the strict definition, it is not an experiment in the strictest definition. So when we talk about experimental studies, there are ways we can also group them. We can group them into true experimental studies, quasi-experimental studies, and then there are some people who add another group, the pre-experimental study. And in case you read anywhere and you see maybe they list any more, my internet is unstable. In case you read anywhere and you see more studies, you would already have the baseline in our head and we can understand whatever is being said anywhere, right? So for true experiments, there are some things that will happen for us to say this is an experimental study, a true experimental study. Number one is manipulation of an independent variable. Number two, the presence of a control group. Number three, randomization. So these three things I mentioned, if they are present, then we can say this is a true experiment. If they are not present, then we can start saying, okay, is this a quasi-experiment? Is it a pre-experiment? What kind of experiment is this? But if we see the three, there's manipulation of an independent variable, there's the presence of a control group, and there's random assignment or randomization, then we can say this is a true experiment in the truest sense of it. Okay, so now let's explain what we mean when we say manipulation of an independent variable. It's very simple, like ignore the big grammar. It just simply means that, like we have said quite a number of times, that we are introducing something. The researcher is introducing something. That's the manipulation we are talking about. There's an exposure that we are introducing. We want them to be exposed to a particular thing. That thing can be a vaccine. We're introducing it. It can be drug. It can be a health program. Maybe health education, like all this health talk. It can be a health app. It can be anything. But that thing was not present in that population before. It may be present, but not to a good extent. But we are bringing it, we are introducing it deliberately. We are bringing in that intervention. So that's manipulation of an independent variable. And remember what we said about independent variable. It's independent because it's standing on its own. There's an outcome that will depend on it. So we are saying we want to give vaccine. What are we doing? The vaccination is the independent variable because there's an outcome that will rely on it. To say, will the child receive, if a child receives vaccine, will they develop the disease versus will they not develop it? That developing the disease versus not developing, it depends. We're now saying it depends on whether the child receives this vaccine or not. So the vaccination is the independence. So we are introducing something. There's something we are introducing. We are manipulating variables. We are manipulating our independent variables to see if we can have a different outcome. There's one quote then that they used to say that doing one thing so many times and expecting different results is whether, I don't know, is not wise, something like that. So that's what's happening here. We cannot just be watching people and expect different outcome. We just be watching people and expect that cholera will vanish. We just watch people and expect that the malaria incidence will reduce. We have to do something differently. That is where we talk about manipulation of independent variable, bringing in the intervention so that we can see if that our thing can cause a different outcome, a different result. Okay, that's the first criteria. The second thing is the presence of a control group. Now, what does this mean? Control group, they are also referred to as comparison group. What it means is that, you know, There's no way for us to tell maybe our vaccine worked or not if we just give everybody the vaccine. We can tell, we can say, okay, there's a drop in prevalence before and after, but if we are talking about a true experiment, there will be a group that do not receive that vaccine so that we can say, oh yeah, look at it, oh, look at it. The people we gave the vaccine, they were 50 in this group, group A. They were 50 in group B, and we gave group A the vaccine, and we did not give group B the vaccine. And at the end of the day, we realized that only 5 kids in group A developed the disease, but in group B there were like 30 kids that developed the disease. And then we can say, the vaccine was, it worked. The vaccine was what caused the change. Now listen to the word cause, because when we talk about true experiment, there's something called causation. We're trying to establish causation. In the descriptive study, remember we said you generate hypothesis. In the analytical studies, you test. But the thing about analytical studies is we cannot even beat our chest to say, I think it is this thing that is causing this thing. We can only say there's an association between unsanitary condition and increase in maybe gastroenteritis, cholera. But you cannot say it is this that is causing this. At the level of an analytical study, we cannot establish causation. We can only say that there's an association. Maybe a strong association or a weak association. That's the much we can say for analytical studies. But when it comes to establishing causation, we now start talking about experimental studies. And that is where we are now saying that there has to be a control group. Because if there is no control group, how do we know that what we gave that caused the change? We need to see that those who received the intervention, there was a difference compared to those who did not receive it, a significant difference. Otherwise, you can say, well, it's just chance, so it's just by luck. It's not anything that you give. Okay, so that's the second one. Then the third thing we said must be present is randomization. Randomization means when it is time to select who is going to get the intervention versus who will not get the intervention. You are not going to do it based on how you want to do it. It's going to be random. So if there are 100 participants in a study, you can, and you give each of them serial numbers. You can use some of these apps or software, generate random numbers, and the software will tell you that number 5, number this, number that should be the ones to receive the intervention, and then number this should not receive the intervention. Otherwise, there's going to be something called allocation bias. Because what if you just like one set of people and you say, let me give, these are the people that I should give this intervention to. Maybe you like people that are dark, or you like people that are fair, or you like, and then anytime you see those people coming, you'll be like, come and you join the intervention group. That's where you're going to put that person. When that happens, there's already bias. And what we are trying to minimize in our studies as a whole, we always try to minimize bias. Because if there's so much bias in our study, then it may not hold true. There won't be something they call internal validity. It may not hold true. Okay, so we've mentioned the 3 things. We said there has to be manipulation of an intervention, of an independent variable, that is intervention. Then there has to be a control group, and then random assignment, randomization. So when all of these are present, because if there's randomization, then you will know that it's not like me, I did anything, no, it just happened. It was not like I was selecting who will get the intervention or not. It just happened. So those 3 things, now when they are present, we can say that it is a true experiment. So what's an example of a true experiment? An example of a true experiment, the main example is randomized controlled trials. When it comes to evidence synthesis, randomized controlled trials, they are at the top. They are the oga when it comes to being able to establish causation. They are at the top. They are the top guys. Because if we go to our LMS or we read, we're going to see the limitations of case control. There are limitations. There are limitations of what's the other one? Cross-sectional study. I cannot use cross-sectional study, for instance, to say I want to establish causation. Good. Another thing I also need to mention is, okay, no, let's just go ahead. Okay, so randomized controlled trials. In this one, they are the study design that meets the criteria of experimental study design. They have the three things we talked about. They have it. Now, there are different types of randomized controlled trials, which I would implore us to maybe check up on our own because we are pressed for time. We're going to be stopping soon. So there's clinical trial. Clinical trial, those ones happen mostly in the hospital setting, and it happens we're using people who already have the disease. So when you hear clinical trial, it's mostly like maybe, let me say, a drug, right? We want to know whether this drug is effective or not, whether this drug works or not. So we call the people together. And then already, remember, we said there has to be, for it to be a true experiment, there has to be an intervention. So our drug is the intervention. There has to be, what's it called now? There have to be control group. So it means we will give the drug to these people. That drug we're interested in, we'll give it to one group. We will not give it to another group. Or we can give another group another thing entirely. Sometimes it can be more than one group, like it may not just be rather more than two groups. So then after that, the other thing we talked about is what's it called? We said, yeah, so randomized control trials, basically it has the three elements of a true experiment. An example is clinical trial. Then the other one is field trial. So field trial, note that it is among healthy individuals. When we talk about field trial, it's not for clinical trial, it's mostly hospital setting among people who already have a disease. For field trial, we are carrying out our experiments among healthy individuals. Most times it is used to evaluate prevention, like preventive interventions. Okay? So the example here is vaccination. Then we have cluster trials. Cluster trials means this time we're randomizing. The basis of our randomization are groups. So I can say this community will receive the intervention and this other community will not receive. Or this school will receive, this school will not receive. You get, this country will receive, this country will not receive. So it's cluster that is our basis of our randomization. Remember, for the other randomization I talked about, I said it's persons that you are going to randomize. You say this person will get the drug, the other person will not get it. But when we're talking about cluster trial, what it means is that we are using this entire community and they are the ones that will get the intervention. Then the other entire community, they are not going to get anything, and then we do our comparison. Okay, the other thing here is, okay, so I'm likely just going to share this notes with us. Time is fast spent. Then we have the quasi-experimental study designs. Now for these ones, people, they are different. If you check, you will see people define it in different ways, such that you may not even know where you want to put it. But the way that makes sense to me is to say we have the true experiment, we have the quasi-experiment, and we have the pre-experimental study design. So for quasi-experiment, what is lacking there is randomization. This one is mostly used to study policies. So you can say, okay, we're making policy that every pregnant woman should receive free antenatal care. And you see that one community will adopt that policy, the other community will not implement it. And then we are not the ones, me the researcher, I was not the one that brought this thing there. My own is just to go there and go and study that, okay, there's already a control group. One community implemented, the other did not implement. Let me go and study. But I cannot randomize. Why? Because it's not in my power. So I can't randomize, but there's a control group. And I said it's mostly used for policies. So you see that these people have implemented, the other person have not implemented it. Then you just go there and check and say, okay, let's see the difference between those that implemented this intervention. The intervention, it was not necessarily you that put it there. So we just go in and study. Now in quasi experiment, note that there is no randomization. It is not in our power. We cannot randomize. We are not the ones telling the community that you must implement because I want to carry out a study. No, we can't randomize in quasi experimental. Then there's pre-experimental study designs, and here we have there's no randomization, there's no true control group. So both things they are missing, but there's an intervention. So look at it. True experiments, they have all three components. Quasi experiment does not have randomization. Pre-experimental does not have randomization, does not have a true control group. But there's an intervention. Now, what is an example of this pre-experimental? An example is something they call before and after. Pre-test versus post-test. It's like you are using the individual as their own control. Something like somebody has a disease, and then I am now measuring, okay, you had this disease, or you come and take this drug. I want to study what is now going to happen after you take this drug. So that individual is the control for themselves, something like that. So that's pre-experimental. And it is often done before a proper experimental study is carried out. Okay, so there are other things in this note. There are other things in this note. It's my reading note. I tried to make it a bit understandable since I was going to use it to teach, but I'm going to share it. I'm going to share it on the group. Okay, so this is 922. Please, if we have any questions, we can share them. Should we take questions now? We can share them on the group. Please, let's put up our questions on the group, and then we are going to try to answer the questions there. Am I still on the call? Hello, can we hear me? Please. Okay. Yeah, so basically I think we were able to achieve, we're able to, get a basic understanding of these study designs. So we can go back and, just look at our materials again so that they will sync. The reason it's important is like it's a study design is a main thing for us in epidemiology. So yeah, we can put up our questions on the group, and then I would collate them and would try to answer, or anybody who can answer would answer. But thank you very much for attending this session. So tomorrow we are also going to meet. Tomorrow we are going to meet. Please, let's try to meet every day so that we can cover as much as possible. Thank you, everybody. So I'm sorry that this took longer than expected. I'm sorry that it took longer than expected. So thank you. We're going to end the call now. Thank you.